I've had people come to me in tears, literally just thankful that they had this opportunity to really talk to a pharmacist, because maybe their doctor didn't have the time to explain how the insulin worked, and then they had this opportunity. So I can't explain how valuable it is, other than the fact that it's changing people's lives.
So we're trying to help people transition from the idea that your doctor's in charge of your health care to you're in charge of your health care. For our clients with diabetes, I have to do things for myself that I never, 24/7, that I never had to do before. That's our goal, is to transition them to love, to begin to take care of themselves and to teach them how to do that. So now their interactions with their entire healthcare team is different.
Any person that comes in for education, I'll ask them questions about the foods they're eating and where their blood sugar levels have been, and really just try to establish a relationship with them. It's also about collaborating with the patients as well, and then we will try to decide what's the best fit for them as far as education goes.
It's just all part of that whole integrated delivery of services to folks so that they can have the best possible information, the best possible education, and have something available to them as an underserved community that they really can't get anyplace else.
When they first told me I was diagnosed with diabetes, before I came to the class, I'm at the grocery store trying to sugar-free this, sugar-free that, but I didn't realize that carbs were already stored sugars. At first, I felt like I was starving myself before I knew about the program, and now it's like I can have 6 carb choices for breakfast. I mean, that's a whole lot of food. So I've just been working that program, and I've lost like 23 pounds. My sugar's down, I'm off of insulin, and I mean, I don't know what else to say about it. It's wonderful.
People are taking care of themselves, and I'll call them to do 3-month follow-ups, and I'll hear about their A1Cs dropping, and I'll hear that their goals are falling into place as far as maybe it's losing some weight, and it really is encompassing not only the physical and the food changes that they're incorporating, but the medication piece is huge as well.
I'm allergic to a lot of medicines, especially sulfas, aspirins. And when I told the pharmacist that, and I told her about the sulfas, she said, well, that's good to know, because there are some diabetic drugs that they will put you on that are sulfur drugs. And she wrote down a list of them. So that equipped me with information to take back to my doctor if, in the future I had to get on a different kind of medicine. These are some of the medicines I can take.
You get these drugs and you get the medication, you get these big bottles of pills and 3 or 4 of them, and you don't really know what they're for, how they're going to affect your body. And she sort of led me through, this will happen, these are the side effects, this is why you're taking it. You feel better taking something and not just popping something in your mouth because the doctor told you to.
So I think that by incorporating a pharmacist and pharmacy consults into our diabetes self-management education focus, which is the keystone of what we do, it does make it easier for people. And it makes it more attractive for people. And it makes it something that they can comply with that much better.